早晨，咁多位同事，而家個
Good morning, members. We have now formed a quorum. I now call the meeting to order. Information paper issued since the last meeting. 2 papers. One CB bracket 2 515 stroke 1415 bracket 01. Another paper is CB2 341 slash 1415 bracket 01. They are for members' information. Items for discussion at the next meeting. There are 3. The setting up of a contract RCHE in Sha Tin, and also adjustment of the fees under cap 290, and also the elderly healthcare voucher scheme review. These are for the next meeting. Any comments? If not, then we'll proceed as suggested. On the 20th of January, we are going to have a special meeting, a public hearing to respond to the government's proposal on elderly services. Many deputations, 44, have signed up. So, members, what do you think if we advance the starting time? Instead of 10:45, shall we start at 10 and then we'll end at 1 p.m. so that we can have 3 hours. The 44 deputations will take up more than 2 hours. We need 3 hours for the meeting. Any comments and questions? Dr. Helena Wong, I have no comment on this suggestion. I want to say something about item number 13 on the list of outstanding agenda, provisional child care services and after-school care services. I would like to have this item discussed ASAP. All right, but maybe we'll hear something from the government on Wednesday. All right, so the meeting time for the meeting scheduled for 20th of January will be as what I've said. Let's now invite the administration to come in. The next item on our agenda is update the progress of Child Development Fund. We have 2 papers, CB 2553 slash 1415 bracket 03, another one is bracket 04. I would like to welcome from the Labor Welfare Bureau, Ms. Annie Tam, Ms. Jane Lee, and from Social Welfare Department, Mr. Peter Ng. Welcome to you all. Maybe the Permanent Secretary can give a briefing to us. But this is about the latest progress of Child Development Fund. The CDF, Child Development Fund, was set up in 2008 upon the suggestion of the Commission on Poverty. And the NGOs were contracted to operate the scheme. The target service recipients are children from the grassroots or from a disadvantaged background. We have been trying to help them with personal development, accumulating savings, and other services. We provide services to those from 10 to 16 to come up with their own development plan and in the first 2 years, the parents would save up some $200 a month in the first 2 years, and at the end of the 2-year period, they would have $48,000 through the scheme. And there's a matching fund provided by people in our community. So there's another 48,000, and there's also a financial incentive of 3,000 from the government. So the money will be accumulated to provide the financial resources for their plan, for example, to enhance their language competencies or to receive training such as musical training. And there's also be the mentor scheme, so that an experienced mentor would provide assistance and guidance. And we also provide training for the children and the mentors, so there's a training fund. And because there is also the need to carry out administrative duties, we also fund the administrative costs. In April 2003, we came back to report on the progress, and we said that in 2014, 2015, we're going to enhance the schemes. We'll continue to invite NGOs to operate the programs, and we are also going to have a 1+1 approach. And that is after the first round of tendering, if the score is good, then they don't need to participate in the second round of bidding. And some members have also said that we should cover more children, and we'll look at the capacity of the NGOs, because such projects have to be limited because of capacity. And we also carry out some school-based programs. And of course, schools can partner with other NGOs, or they can invite NGOs to run the program in the school. And then we're also going to step up training for NGOs and give them a higher budget for administrative costs. So far, we have 4 batches of NGO-run CDF projects. Some 6,500 children have been benefited, and a few hundreds are from the disadvantaged background, such as racial ethnic minorities, those living in cubicles or subdivided units. So altogether, we're talking about some 7,000 beneficiaries. We're going to launch the 5th batch of NGO-run CDF projects. Under that, we are going to have the 1+1 approach, and that is to say the successful NGO would no need to enter another bid in 2018. And we are going to launch a second school-based projects. Having assessed the progress and talked to schools and NGOs, the steering committee have decided that after the 5th batch, and that is starting from the 6th batch, we'll carry out some enhancement. The school-run projects will continue to be offered, and we hope that they can offer more flexibility. And that is, it would cover primary 4 to secondary 4 instead of the age bracket of 10 to 16. But this only applies to school-based projects. After the introduction of the low-income family, working family allowance, if it's approved by the FC, by this council, then children from low-income family will also be covered by our projects. Both NGO projects and school-based projects will receive a 10% increase in administrative costs. Last time, we were asked to increase this incentive of $3,000 to a higher amount, and now we're going to use a matching grant basis, and that is the child would save $48,000, the matching of $4,800 from the child, $4,800 from the matching grant, and the government would do likewise, so there will be an increase of 14.4% in the total amount saved. As for increase in training and administrative costs, instead of $19,000 odd, it will be increased by 1.5 times to $29,000. On the financial commitment, with the launching of the fifth batch of NGO-run projects and the second batch of school-based projects, the $300 million grant approved in 2008 will be exhausted, and after 2016, we'll have to utilize the other $300 million earmarked for CDF in the 2014 policy address. Such a commitment will be met in 2016. That will be reflected in 2016 budget. We believe additionally 9,700 new participants will be benefited because of the increase in the provision. We'll only be covering 9,700 new participants additionally. The details are set out in the paper. We hope to have the benefit of members' comments and opinion today so that we can do a better job in the future.
All right, so members can now ask questions or give comments. I'll read out the names: Poon Chiu Peng, Ronnie Tong, Leung Yu Chong, Leung Kwok Hong, Helena Wong, Fernando Zhang. So each member will have 4 minutes. Mr. Poon Chiu Peng. Thank you, Chairman. Now, I in principle support the CDF, but I want to know more about a few areas of the fund. Concerning school-based participation, may I refer to para 10A. It is said that the steering committee considers it desirable to roll out more school-based pilots in the 2015-2016 academic year, and preparation is being made for this purpose. I want to know the progress of such preparation work, because it's now 2015 already. So I want to know when the school-based pilots will be expanded. And then second, we hope that the CDF can minimize intergenerational poverty. So how can we make sure that these children have acquired the habit of saving? I understand that the Polytechnic University has been hired as your consultant, but how can you make sure that the children will save money on a continuous basis? Yes, Chairman, thank you. There are about 50 NGOs involved in children and youth work, and about 21 of them have taken part in our programs, and we hope that more NGOs can join the program. But then we've got 10 schools responsible for 7 projects, and this is because some are joint school projects. And the results have been encouraging. And so in the 2015-2016 academic year, we hope to roll out more school-based pilots. Some schools have said that they would like to roll out projects during the summer holidays, and so we hope that approval can be given in July so that the projects can start in October. And then for this for the second question, we hope that the school or the NGO concerned can tell the students and the parents right at the outset that these are target savings plans. And so we hope that each month $200 can be set aside for savings. Now, the school or the NGO does follow up on the cases to make sure that this is done every month in the first 24 months. But then if the parents and the students can't really achieve the $200 target, then the amount will have to be adjusted downwards. In fact, about 90 children have failed to meet this target. We may ask the school or the NGO to top up the amount. So we hope that apart from having PDPs, the children can also have personal savings. So this is from P4 to S4, and is it that after beyond P4 we can't take further follow-up action? Now, in the first year and in the second year, there are supposed to be savings, and then the PDP can be implemented from the third year onwards. So the agency has to follow up on the implementation of the PDP. In fact, we did commission the Polytechnic University to carry out a tracking survey covering the first batch of children. In fact, the steering committee intends to hire a consultant to carry out a tracking survey for the second batch of children. So, in fact, we've invited interested parties to put in bids, and we hope that we can award the contract for the consultancy study later. Ronnie Tong. Now, concerning this project, we are worried that the effect is not enough and the coverage is not enough. Now we can see that only about 2,000 to 3,000 students can benefit. So concerning this number, I want to know whether they come from different families. Has there been any duplication of resources? And then second, we want to know how many children need assistance. Is it that there are only 4,000 to 5,000 children in Hong Kong who need assistance, or is it that there are far more than this number who need assistance? So we want to know whether this scheme is really adequate to help the children in need. Permanent Secretary. Now, we hope to reduce intergenerational poverty through this project, and so we will try to expand the coverage of this program. I want to say that each program lasts for 3 years, and I want to say that for the figure, there is no duplication. So in other words, if a child has taken part in one project, he can't take part in the other projects. No, a child takes part in all three projects or elements. And these NGOs will also give assistance to the families. These are NGOs which have been serving children, young people, and families. So I want to say that a child will take part in all three projects. So there is no duplication concerning the number. And then is there a duplication between the figure for the first batch and the figure for the second batch? And I would like to know how many % of the children in Hong Kong do need the assistance. I want to say that there is no duplication concerning the figures. Now, for example, we have 1,454 children under the second batch, and so they are covered in the year 2010, 2011 for a 3-year period. And then for the 2043, they will be covered in 2012, 2013 for a 3-year period. So altogether, the total should be 7,000. And then with the $600 million, we should have a total of 22,000. But of course, I understand that the number of children in the grassroots sector who need assistance exceeds 22,000. So can you tell me how many? Now we are covering those whose families are on the CSSA and whose those in families with a median income of less than 75%. And then for families receiving the low income family allowance, the children will be selected to take part in the projects. If we just look at the poverty line, the family income, we know that over 100,000 or 200,000 children need assistance. But then for the age group 10 to 16, we haven't got the figure yet. But we are trying to extend the coverage, and so we think school-based pilots will help expand the coverage of the scheme. But then only a few thousand children have been covered, and yet over 100,000 children need assistance. So in fact, the percentage covered is very small. And what do you mean by over 100,000? Are you talking about 110,000 or 190,000? Because there is really a very big difference between the two. Permanent Secretary, we'll have to take a look at this again, because we have to study the report on poverty. I'm alarmed, Chairman. So you're going to carry out a review, and how come you haven't got the figures? How can there be an effective and meaningful review? I believe they've got some estimates, but they haven't got the exact figures. Mr. Leung Yu Chung, I need to declare interest because my organization is also one of the participating organizations, and I want to say that in fact some children have really benefited from the scheme. Some have gone into university, and they are serving as volunteers to help other poor children. So we can see that in fact they have benefited from these projects in various ways. But then I've got a few questions. This is a 3-year project. And the mentors and many think that the duration is really a bit too long. So if the duration is 2 years instead of 3, then the resources will be able to help more children, and more children will be able to benefit. So we think that 2 years should be enough. That's the first point. And then second, for the so-called older young people, I think their habits have more or less been established. But then for the smaller children, you can shape their habits more effectively. So I think you should really focus more on the primary school children. So should it still be 50-50? Can you adjust this? And then thirdly, the intention is to help these children save money for a purpose. For example, they may want to learn to play a musical instrument, and so they need to save the money to buy the musical instrument. But then we understand that in some cases the money saved is used for supporting the family or meeting family expenditure. So do you stipulate or can you stipulate that the money should be used for certain purposes, because it is said here that you only require that receipts be produced. But then I think the situation is not clear enough. You should list more details. And then there are some mentors who provide assistance year after year. But then for the mentors, you are really not too sympathetic towards them. You require them to undergo training every year. But then these mentors have already undergone the training, and they don't think they need to attend the courses or the sessions again, and they may not have so much time to attend the sessions every year. So can you grant some exemptions to experienced mentors? And then organizations have been they need to provide the training to the mentors, and then at the same time they need to raise funding. So it's that in fact they should be allowed to spend more time and energy on helping the children. And then administrative fees, this has been increased, or this, and agencies find it very difficult to cope, and also inflation is high. Yes, Permanent Secretary. Yes, I in fact have met the NGOs a few times on this project as to whether the duration can be shortened from 3 years to 2. Yes, we can look at this further. But then if the duration is too short, then the amount of savings will be relatively small. And so there may not be enough money and enough time to implement the PDP in the 3rd year. But then we will look at the situation. We'll keep the situation under review. We, at the moment, feel that 3 years is appropriate. But of course, we'll have to look at whether it will still be effective if this is reduced to 2 years.
As for the older children and younger children, and the ratio is a half and half. Of course, there are benefits to join early. There are also benefits to join later in life because they are better able to plan if they are older. We'll allow the program operators some flexibility. We encourage the children to spend the $48,000 and the matching grant well, and the money should not be used to support the family. It should be used for their plan, because we want them to devise their own personal development plan and realize the target. If the family has financial needs, we would like the NGO to refer them to relevant organizations. We also want to show our appreciation to our mentors. If they are experienced mentors, perhaps we shouldn't ask them to receive training every time. I'll ask the NGOs again to see if we can dispense with the training. But there may be some refresher courses, but that's another matter. We can discuss that later. The training organizations would jointly raise funds with the business sector. And there's also the CDF matching fund, which can also be utilized to raise funds, or they can ask the SWD to find suitable fundraisers. In 2013, we said we would raise the administrative support on 15,000 to 20,000, and now from 2014, from 2015, we are going to add another 10% to that in 2016. The CPI has raised about 7% in that period. So we are more or less in line with this CPI movement. We understand that the $1,500 or $2,000 given to the NGO may not be sufficient, depending on the profile of the children. So in the future, maybe next time, we would take another look. But we believe that this time the adjustment is for is 10%. It's more or less in line with CPI movement. Mr. Leung Kok-hong and then Dr. Helena Wong. Well, this is laughable. Mr. C.Y. Leung gave $300 million plus $300 million to these people, and the message behind is that people are poor because they don't know how to save money. Well, we are just trying to help them save. So you are saying that they don't know how to save. That's the same thing. So you give $600 million and tell people why these people are poor. They don't know how to save money. This is laughable. It's like paying your mortgage. Property prices are rising all the time. You are telling people to buy a cheaper flat. Don't just pay higher and higher mortgage. Well, do you have a housing allowance? So would you be asking people to go to Tin Shui Wai to buy their homes? And then I will have a matching grant to provide an incentive. So if you pay less in mortgage. Well, normally people don't want to live in remote locations. So this program looks good on the surface. But if we look at the figures, as Mr. Ronnie Tong has rightly asked, it's a different picture. You tell these people to save money. You should have this habit, and I'll pay you an incentive. Otherwise, so either they have to falsify things. Well, chances are that they falsified the records. Is Mr. Peter Chung to tell me that I would be given $3,000 and I would, if I save $3,000, I don't have the money. I borrow it from a loan shop, and then I repay the loan shop with your $3,000. You're going to give $15,000 to the NGO, and also $1,500 as well. Is it an inclusive sum? I mean, it's 15,000 inclusive of the 1,500. The mentors will be kept very busy by this. So C.Y. Leung is just trying to tell people that the administration has been doing something about it. This is what bureaucrats would do. If criticized, they would say that I have a fund, I have a steering committee, I have a program. So Mr. Ronnie Tong has asked a very valid question. The provision is insufficient, the coverage is insufficient, the distribution is uneven. So just leave the children alone. Don't send a child who has graffiti a wall to a children's home. So this scheme, this project, is really something that no one would like, but we cannot say no. Thank you. Dr. Helena Wong. Well, the concept looks fine, but I have many doubts, including the saving component of the scheme. These children are coming from CSSA children or children receiving full subsidy in schools. How come they have money to save? If they have money to save, they don't need your help. Where does the money come from? From the mother or from the father? We're talking about CSSA family. It's not that they have money there and they just don't know how to save. And you're not going to give money to their piggy banks and saying that if they match the saving, the whole sum will be given back to them. So I just cannot figure out how this works. And according to PolyU, how many families are going to spend the money as planned in the third year? Only 16.3% will be doing this. You don't want them to spend the money in the first and second year, but only 16.3% of the participants spend the money in the third year. Where does the money go instead? The money will not be allowed them to be lifted from poverty. They have to make the best use of the money saved. They need to spend the money to be enrolled in summer courses, in training courses. And I have received a petition from a concerned group on children's benefits. 137 families were interviewed by this concerned group, the all target families. 70% of them do not know that such a project exists. If you want to resolve intergenerational poverty, but 70% of the target families don't know the project exists. And the biggest need is during summer vacation. They have nothing to do. They need to join different courses or tuition or skills training, but they don't have the money. And now you ask them to save money, and the resources are really provided to the NGOs. Administrative costs, training costs. You're not spending money on the children so that they can enroll on summer courses. So what kind of training is provided? What kind of activities are provided through the projects? Well, there are three components, and they have been well tested in other places. But we're just pulling together the three elements, the three components. We want them to save money, to make it a habit, and we also have mentors to help them. We would like to achieve a better result through the incorporation of three elements in one scheme. It doesn't mean that we don't need to help these children through other means. The families will continue to be assisted. For example, the CSSA, the textbook allowance, school fee waiver, after school childcare or tuition and support. So this is in addition to other measures to help the children. We hope that through some positive experience, through interaction with mentors, and through the efforts exerted in saving $200 a month, and then they can achieve a target after 3 years. We hope that such positive experience and outcome will help them better cope with life problems in the future. So it carries other significance. It's significant for them in many ways. And we hope the child and the mentor will both receive training to set targets and to properly plan for their life and to understand for example, the academic system thoroughly. We have set out in the paper that through the media, we have been trying to publicize the successful stories and also the insights gained by the participants and the mentors. We hope other organizations can also help us and accept these children. For example, some corporations are doing this to help them. And also, there are other forms of support and sponsorship. For example, there's a film on young people's and their experience in striving for a better life. We receive some tickets. So for the training part, you can give them vouchers which can be used to purchase some activities, summer courses. Well, your time is up. I think you have made your proposals known. The Bureau will respond, I think, in due course.
Fernando Zhang and then Tan Ka Piu. Now the CDF is one of the main recommendations of the first term of the Commission on Poverty. The Commission was concerned about intergenerational poverty. I understand that this asset-based idea, originates from other countries. So this. We have professors like Michael Sheridan who have come to assist in the planning and the launching of the program, and the Polytechnic University was hired as the consultant, and I also took part in the consultancy work. So this is an asset-based project, and so assets are required. Initially, $300 million, and then you may need another $300 million. And so the child saves $200, and then the agency try to get someone to provide a matching amount, and then 2 years later the government provides $3,000. So, but then the total will only be about $10,000. And I understand that you've already covered over 7,000 children, and in the future you may be able to cover another 9,000. But then for the child poverty rate at the moment is 24%. We have a quarter of the children in Hong Kong, in other words, those who are under 18 who are poor. And for those who are between 10 to 16, we are at least talking about over 100,000. And so you've been able to help only about 7,000 children, and after the 2 years, the child will only get about $10,000. So how can you really help these or lift these children out of poverty? And for the assets, we're only talking about 15% out of the $300 million. Over 70% of the assets or the money has gone into the mentorship program. I'm not saying that the mentorship program is not good. In fact, the mentorship program and the savings complement each other. But then they said that too much has gone into the mentorship program. It's I think helping the children accumulate assets is an important element of the program. So this program seeks to lift the children out of poverty. So I think you should follow the examples of the UK, the US, and Taiwan. And in fact, there were seminars, experts spoke at the seminars, and in those countries, children can accumulate assets which can really lift them out of poverty. As Mr. Ronnie Tong has pointed out, we think the scope of the program is not enough. We think the program is not enough to really help those in need. Now, in fact, in the Commission on Poverty, we are looking at other ways as well to help families in poverty, especially working families with many children. So we hope that the Finance Committee can approve the LIFA as soon as possible. And this is going to be an additional way to help poor children. And we have the target savings plan, and we have the mentorship program, and we also have the PDP. So it's a three-pronged approach. So we hope that the children can realize their goals with the support and the assistance of the mentors and the agencies. We also hope that the social network can also be expanded, and as a result, they will be able to build up more confidence in themselves. Now, in fact, we've never believed that the $10,000 saved will lift these children out of poverty. But then we hope that they can accumulate a positive experience and can shake off some of the culture they have had as members of poor families, so that they can build up more self-confidence. And in fact, there is proof that the experience that these children have had will benefit them in the long run. And of course, we'll be having another consultancy study to really assess the effectiveness of the scheme. Now, yes, we can try to secure more funds, but then the schools and the NGOs have just made a start, and so the coverage of the program can't be expanded overnight. Now, at the moment, we already have many of the NGOs which have been serving young people and children, providing the service, and 10 schools have also taken part. So I hope that that we can see progress here step by step. But then for the Lien Thang border crossing, it costs $30 billion. So how come we can't have another $300 million to help the children in need? Ms. Tan Ka Pil, I want to say that for Yat Chong Estate, in fact, the quota was taken up very quickly. The program started in 2008. 6 years have already elapsed. So, can you track the development of the children who may now be in their 20s already? So, can your tracking surveys tell us the effects of the program on their character, on their concepts about time and savings and money? Because we shouldn't simply look at the $10,000 odd. We want to look at the number of beneficiaries and in what way they have benefited. And then I want to say that housing is one of the contributing factors of poverty. We may have 2 families with the same income, but then one family lives in a PRH flat, one in a partition room, and that there is a world of difference here. And so have you done some comparisons? Say, have you discovered that for a poor child living in a partition flat, it's more difficult for him to save $200 a month? And then it's quite impossible to require a family to save $4,800. But then for the $22,000 provided by the government, will the amount ultimately benefit the children or the organizations, the intermediaries? So for the $22,000, how much will go to the families or to the children? So I think the $22,000 shouldn't be used by the agencies, by the organizations to organize summer vacation activities like war games. The money should be spent on the child. In other words, used to enable the child to do what he wants to do or learn what he wants to learn. Now schools are in the best position to contact the students, and that's why now schools are also taking part in the program. And schools may also want to have the assistance of the NGOs. We're happy to see that many of our participating schools are schools with more children living in public housing estates. And also there are about 50% of the NGOs serving young people and children who haven't taken part in the program, and we hope to persuade them to take part in the program. Now we did the first tracking survey covering the first batch of students or children. In fact, in overseas countries, they have the experience of carrying out tracking surveys over a long period of time. So we'll ask the consultant to carry out a follow-up survey on the previous one. And we hope to receive a report from the consultant in a year's time. And then the 22,000, that's the training money. And the money will be used by the child, and the subjects, so to speak, include establishing social networks, money management, and so on and so forth. And these are experienced NGOs and experienced schools, and they are in the best position to assess the best training for the children. So the $22,000 will not be used. In other words, what I mean is that the children don't have to say concerning how the $22,000 will be used. Now concerning the $14,400, the child can have all the say. This is the $4,800 times 3. So $14,400, the children can afford to say. But I'm worried that the $22,000 will be used by the NGOs to organize barbecues, or war games. So the $14,400, this for this amount, the child can have all the say. For example, say if he has reached the age of 18, he may want to learn driving, or he may want to learn to play a particular musical instrument. But then for the training amount, we have to have the consent of the organization, the mentor, and the parents. Mr. Tam Yu Chong, many are of the view that this amount is really not enough. But still, I think it's better to have it than not having it. And it's good that this we now have schools also pitching in, because schools and teachers understand the needs of the children, and they come into contact with the children almost on a daily basis. And so I think it's good that we now have schools taking part in the program as well. And we hope that this CDF can operate on a sustainable basis. And I really look forward to seeing sustainable and systematic development on the part of the children. Thank you. Any response from the Permanent Secretary? Thank you. We are also concerned about sustainability, Chairman. So before we used up the $300 million, we asked the CE to reserve or earmark another $300 million. And I'm sure this amount will be available in the upcoming budget exercise. Mr. Albert Ho, as other members have pointed out, I think it's a joke to say that this program can help minimize intergenerational poverty. The amount is so small, and you require these very poor families to save money. And some people say that in fact you do not understand the difficulties faced by the poor families. In fact, they have immediate financial problems, and so how can you expect them to be concerned about intergenerational poverty? So it's like saying to them, if you don't have money to buy bread, why not eat meat? So I want to know whether you've also carried out surveys covering those who have left the program. Do they still have savings? And what are the financial difficulties that they are facing? And have they really benefited from the program? I'm in particular interested in those who are working in society and have left the program for a rather long time.
I believe the benefit is limited. You just spend a few $100 million. I won't say it's money spent with no achievement, but we are not talking about money spent on the immediate needs of these people. You want these people to save money. It's going to be difficult. I think the controversial issue is that you ask them to save money. You say this is just it is about encouraging savings. Well, but they don't have money to begin with. They may have to live on the CSSAs of family members. It's more important to deal with immediate problems of poverty. Of course, we need to deal with intergenerational poverty. As I've stressed, that the CDF project is not provided to provide immediate financial help. Well, such needs should be taken care of by CSSA or the coming LIFA. These families are already receiving such benefits, or they will be referred by the NGOs. When we don't want to just address their immediate needs. We want children to lead a positive life. We also want them to have confidence and have a positive attitude towards their social network and their plan. So we hope that they can come up with a plan, and then through assistance rendered by other parties, such as the mentorship scheme, they can realize the plan, and the message will be very positive. This is for a long-term goal. We are not just trying to provide financial relief and at the expense of addressing the longer-term needs. I have to stress that financial assistance is and can be provided through other schemes. In 2013, we came back to report to members about the progress. We set out that there's a consultant from the U.S. looking at the experience. In future tracking surveys, we'll continue to look into these issues. We hope in 2015 the consultants team can continue with the follow-up survey. And that will be beneficial in understanding the needs of these children and how we should go about the provision of assistance in the future. Well, there are disadvantaged families in the community. Of course, we need to provide assistance through other projects. I have been in contact with some of the NGOs and some of the participants, children participants. There are people who have been trying to help, and the participant will save money so that they can implement a plan. I support this, and I agree with Dr. Fernando Zhang that the money provided is not sufficient. But this is not just about poverty alleviation. I believe that the scheme has been effective and has achieved the intended objective. I want to share with you some of my observations. I believe many members here only have the paper before us to rely on in trying to understand what the scheme is about. So perhaps when the NGOs and the service providers have some activities scheduled for certain periods, maybe you can inform members so that we can all go for a look ourselves. And some members have some views about the training provision and administrative fee of $22,000. So please tell us more about the activities organized by the NGOs, and the information on activities was more or less address the problem on training provision and administrative fee. The PolyU study has been completed in if my memory is correct, but we haven't been given a report. It's on the website. So if you can give us the report, we may gain a better understanding of the progress and the project. And also in terms of the amount saved, it's just $30,000. So perhaps you should try to increase it. And as for whether the administrative fee of $22,000 is sufficient or not for the NGO, it depends on the programs and activities organized. But I have strong views about the administrative fee of $2,200. You are now extending this to the schools. And so, according to some frontline workers of NGOs, it's hard work for them. It's very difficult to organize activities for parents because parents have to work, and activities would have to be organized for evenings, but the schools are closed in the evening. So if a second is a center-based program, you can do it every day. But if you want to go to a school, the organizer has to spend much more time in making the arrangements. So at the same time, the money spent on the service is reduced. There are 7 schools. There are 7 social workers. I just don't know how you can work out the sums. If it's $200,000 per social worker, it's $1.4 million. And you're going to give them $80,000. So what about the shortfall? Will the NGO be footing the bill? You need 4 workers, and not all of them are fresh graduates. Let's say $250,000 per year, and 4 workers will mean $1 million. What about the shortfall? And again, the NGO will be footing the bill. And you're asking fresh graduates to do this, and they may not be experienced enough to do a good job in liaising with the schools and parents. So I hope that when you carry out improvements, please pay attention to this in the future. Next, I'll ask Ms. Chen Yun Han to help us. Next, progress on the implementation of home care service for persons with severe disabilities. Please invite the officials to join us now.
都俾本呢啲咁嘅嘢我，因為咧我都同佢協商咗，佢就同意咗半工半工，得一個全工。佢太辛苦啦，佢唔注意自己身體。早晨。
Good morning. Take your time. Maybe you can use 5 minutes to introduce the paper today. We have 2 officials. Ms. Tama Yi, the Commissioner for Rehabilitation, and Mr. Fong Kai Leung, Assistant Director from SWD. Thank you. We are here to report to you the implementation of the home care services for persons with severe disability. In March 2011, SWD launched a 3-year pilot scheme on home care services for persons with severe disability. The scheme provides a package of home-based personal care, rehab training, and other services. It was funded by the lottery funds, and there were 4 districts covered, i.e. Kwun Tong, Wong Tai Sin, Kwai Chung, and Tuen Mun. In March 2014, the SWD conducted a review of the pilot scheme, as the pilot scheme has worked well, and now this has been regularized, and every year $200 million will be earmarked for the extension of the home care service scheme. And now we have covered all districts in Hong Kong, and the service recipients have been extended to those persons with severe disability who are not in residential care homes. As you can see in paragraph 4, for those who are not living in RCS, then after assessment by reference to the assessment scheme, they can have access to the school, to the service. And also children in special schools who are severely disabled would be benefited. We expect that 3,250 persons will be benefited. And at present, the services are provided by NGOs, and the NGOs would come up with individualized care plans through multidisciplinary approach. And the details are set out in paragraph 5. In March 2014, since we have regularized the services, 1,118 service recipients have been benefited. The SWD would review the schemes regularly, and we will also be liaising with the NGOs and service providers on how to improve the service. That's all for my introduction. The time allowed will be up to 11:45. So 4 minutes for each member. Dr. Kwokake, thank you. This scheme aims at providing help to families with persons with severe disabilities, but the figures are not very good. 1,118 service recipients, but there is a waiting list of 2,900 with the SWD, and this is also this is outdated, and some families are not yet on the waiting list because they are deterred by the long waiting list. So why is there such a big gap? And there are 3 components: care and behavior and rehab. There's a long waiting list for the clinical psychology service, and not affordable actually. Can you give us more details? If we are talking about behavioral problems, they may need therapists to help them, and it must be intensive care. Can you tell us that on average, how much does a service recipient get professional help, not just ordinary home care?
專員。
Yes, please. I think I'll invite Mr. Fong to give a reply. Yes, thank you. In fact, we're only now serving about 1,000 people, so we really haven't met the 3,000 odd target. In fact, as at November, we had about 3,000 waiting on the waiting list. And as to why we aren't able to cover them all, there are a few reasons for that. First, there are some of them who are being taken care of by their families, and so they do not really need the service very urgently. And then second, there are some who have already gone to private institutions, and there are some providing visiting service, or there are some who are receiving visiting service. Now, I want to say that we are we have stepped up publicity, and we've also issued letters to all those on the waiting list concerning this service. But then there are some who still have or still do not really understand the service or have reservations. For example, they do not want so-called strangers to visit them. But have you asked social workers to contact all those concerned? Yes, Chairman. Now, for those on the waiting list, they do not need to undergo further assessments. We have in fact carried out over 900 assessments. And less than 20% of our users are not are on the waiting list. In other words, most of our users are not on the waiting list. And I think that is a good sign. And then concerning behavioral problems. In this service, we are mainly targeting those with severe physical disabilities and severe intellectual disabilities. And so for those who suffer from mental illnesses, they have to make use of our halfway hostels and also the ICCMW. And then for autistic patients, in fact, there are about 200 cases that we are now handling. So this service is mainly for those with severe physical disabilities and severe intellectual disabilities. And for the other 200 odd, you are taking follow-up action, right? Yes, Mr. Poon Siu Peng. Thank you. In fact, there are over 3,000 places, but only about 1,000 odd places have been taken up. Of course, you need to continue to step up publicity. And how can you make sure that more who really need this service will be aware of this service? And then it is said that about 900 assessments have been carried out. How many of those assessed have been rejected, and is there an appeal mechanism for those who have been rejected? And then what about the age profile of those who are receiving the service? For example, those between the 45 to 60 age bracket, or what? Now, Chairman, I wish to clarify. 579 have received assessments. Others are already on the waiting list or have already taken part in our trial scheme. And out of the 579 cases, 434 have been found eligible, and then 94 are not eligible, and 51 are eligible, but I have not chosen our service. So 84% have been assessed as eligible. About 16% are not eligible. They are assessed as not having disabilities severe enough to warrant this service. 6 to 15 years old, 6.8%. They are students in special schools. And they need home care, especially during the school holidays. And then 19% of them are over 60 years old. The rest, 74%, are in between the two age brackets. So for the 51 who have been rejected, can they seek a review of the decision? Yes, they can apply to the units that they belong to for further assessments. But usually for those who have been found ineligible, we will refer them to integrated family service centers or other organizations. Mr. Tan Kap-Hiu. Thank you, Chairman. I have come across an Alzheimer case, and he is only 56 years old, and so he can't be eligible for homes for the elderly. But then SWD has referred him to this service, and so we can see that this service can really help those in need. But I want to know more about the funding model. Because you estimate that 3,250 persons will benefit from this initiative, and about 1,000 places have been taken up after a year. But what if there is more demand? What if more resources are required? Because NGOs may need more resources when the demand arises. For example, it's not easy to hire an additional OT or an additional PT. So when the demand rises, then they may not be able to hire the necessary professionals. And then are you going to give the organizations a lump sum grant or what? Is it that the same, basically the same organizations will be providing the service to the clients? Yes, Chairman. This is a lump sum contract, and if the 6 organizations can meet our expectations, then we will, according to the present procedures, continue to commission them to provide the service. In fact, after the first year, in the first year we expanded the service. So in the first year we gave the organizations all the resources, and then in the second year we look at whether adjustments are necessary. Because there was the expansion in the first year, and so if we gave the organizations only 50% or 70%, then they might not be able to hire all the staff that they needed. And so we decided that the adjustment would come in the second year or later years. Of course, we hope to see more people being able to benefit from the service. So we want to know the names of the organizations. We want to know how many places in each district are still available. And then can you ask the organizations to contact the hospitals, the ward officers, and the integrated family service centers in their respective districts to inform them of the service. Yes, Chairman. Now, in fact, in the footnotes, we do provide information about the organizations. In fact, we haven't really gone through a whole year concerning this provision of this service. And so I think after a year we can provide members of more comprehensive figures. Mr. Fernando Chia. Now, of course, welcome the regularization of this home care service. You see that there is a demand for such service. There are so many on the waiting list for residential homes. So why is it that the utilization rate is not as high as we expected? Now, the Assistant Director has already given some reasons. Now we have different types of home care services covering people with severe physical disabilities, people with severe intellectual disabilities. So I think it's important that there is coordination among these various services. And some of the cases, in fact, under the surface, have been referred from the integrated home care service. We're talking about $988 for the package, and then an hourly rate of $33. But then for the integrated home care service, the rates are lower. For example, for the whole integrated service, only about $19 per hour. So we understand that people, in fact, are interested in this service, but then they may be deterred by the higher rates. And the service is intended for those who have remained in the community. So we have family care, daycare, and also home care. So how can all these services be coordinated so that persons with severe disabilities can still lead dignified lives? I think that's the most important thing. So now we also have cleaning service, meal delivery service, and for the meal delivery service, it is now taking the form of workers buying lunch boxes for the clients. And then we have case management under each system. And so we will be talking about 3 case management systems for one individual. And so there is a lot of overlapping. So all in all, I welcome this service, but I think there must be a review of the community care policies and services for the clients. That must be as little overlapping as possible.
Mr. Fong, we have made reference to our rehab services and also day centers in setting the charges. Yes, it's different from other elderly services, but there's a waiver system. In the past 9 months, 212 service recipients got a remission. Some total waiver, some partial waivers. 39 of them got partial waivers. It's a good suggestion that we should look at other services as well. If we want to implement this smoothly, we need to do this. On the case of case management, it's not that one service recipient would have a few case managers. For these with severe disabilities living in their own homes, they will go to our community support service, and they would have the service of case managers. And these are members of such support centers. There's no overlapping. We have a working group working on guidelines and service indicators. And the guidelines will be used by the different service units, case managers working in different service units, and they will be discharging their duties accordingly. Well, the case manager should be independent of the service provider. And now you're just talking about case work. It's not case management. It's about coordination of services. And to avoid conflict of interest, the case manager should not be subordinated to any work unit. So I hope you can clarify the concept and the arrangement. The steps you are taking are really not right. As I've told Mr. Chui, why is the number so low, just 2,000 odd? According to the administration, a big problem is the fee and charge, and we're told that there's a waiver system. There are people with disabilities who need such services, and I am rather surprised that there are so few service users. What about publicity in the 18 districts? In my districts, many elderly people are not aware of the service. And I agree with Dr. Fernando Zhang. You may have different services. You may want to start with just a few, and then you add more. Now it's time to do some consolidation. The administration should ask the NGOs and the service users. Something must have happened. We need to take a fresh look. Apart from fees and charges, are there other problems? We don't know. Mr. Fong, we are in support of the service. We believe that the service has achieved certain objectives, but how can we manage the service provision better? Mr. Fong, perhaps next time you can tell us more about how we can utilize resources more effectively. It's very hard to fight for more resources for the elderly. So please tell us more. But of course, this is not just the job of the Commissioner for Rehabilitation. Different families have different needs. Some people have told us that their family members are not properly cared for since they have to go to work. So, Mr. Fong and Commissioner, you want to say something? Thank you, Chairman and members. This service was launched in March 2013. The latest figures we have is for the November last year. We are concerned about the service provision. The SWD has been doing publicity all the time. We have reviewed the provision of home care services, and we would like to do some reorganization to improve. We have been monitoring the utilization of home care service. SWD, together with has been consulting NGOs and service users. So this paper is submitted early in the year because we want to carry out a review with the benefit of your comments. Thank you. I welcome that. And in the community, there are elderly people who don't know where to go to seek services. There's some gaps. There are some gaps. I don't know where. Dr. Fernando Zhang, in this package, some would get the full package, some would get individualized services. I want to know more about usage, utilization. What are more popular, or is it that most of them would use the full package? What about individual service components? Are they mainly using the hourly based service, or visiting nurses, or home care services? Can you tell us some utilization patterns? Well, we haven't kept such detailed statistics. I'm not talking about statistics of individual usage. We have personal care, rehabilitation, training, and other services. Roughly speaking, if we convert services into hours, we have provided 75,600 hours of service. So if you have more than 1,000 users in the past 9 months on average, on a per month basis, roughly speaking, it's 67.7 hours. So normally, they get 2.5 sessions of service per week. And they will cover the home care, training, rehab, and hospice service. So we can provide the number of sessions. Can we do more? Yes, if we collect more statistics. Members, this is something rarely happens to the panel. We can conclude our meeting earlier than scheduled. I hope the Commissioner can do more about this. You should go to all the 18 districts. So why is it that we still receive complaints that they don't know the service? I believe you can get some advice from the 18 districts. And also, as Dr. Fernando Zhang has said, please tell us more about the service utilization for all the service components. As we said in the last agenda item discussion, maybe the administration should invite members to participate or to observe certain programs and activities organized by the project. This is not in line with what I have observed myself, or what I've been told. The Commissioner's description is somewhat different from what we have heard. We'd like to know how the organization is done. For elderly services, we have the Commissioner. We have the Commission on the elderly, but not for RPP. That may take more time. Are you going to review community service for PWDs? And there are other services. We must get a clear policy direction and to rectify the rectify the matters that I have just mentioned. We have the new Commissioner, maybe not actually new now. You may be now more familiar with rehab services. You don't want to do the RPP, maybe you have to wait until we have the new CE. Can we do something bit by bit we don't have sufficient residential homes, so we need to do more. If we improve community care service, we can alleviate the demand on residential homes. So can the Commissioner solicit views from NGOs and service providers so that you can provide some rationalized arrangements for day service, home care service. They are always subject to regular review. Every time when we hear from members or users certain comments on the services provided. So members are asking us to review the situation to see if we need to fill some service gaps or make improvements. Well, we welcome the comments and input from members. Also, how or what kind of programs should be provided to PWD through home care service. We know that services for PWDs and service for the elderly may have to be fine-tuned. So members, you may wish to offer more comments from your angle. We are more than willing to consider your suggestions. You have introduced the case management system, and you need to have focal point. The case manager will have look at the full picture, and then he will decide whether there are services that should be suitable for the family member of the person or the person himself. If there's no coordination, and if the case manager cannot direct that certain services be provided and do some coordination, it's not really case management. If you are just looking at the services to be provided within the unit to which he belongs, then it's not a case manager. The case manager is just another social worker in the work unit. So if you want to introduce case management as a system, you should take a look at the full picture. As Mr. Fong has said, in 2014 we set up a unit on case management. We can refer the members' suggestions to the unit. The unit comprises representatives from heads of NGOs and representatives from different organizations representing the disabled, the parents of service users, and Hong Kong CSS. And I believe we can refer the matter to the unit so that they can take another look. Well, I'm also a parent of a service user. Thank you, members. Meeting's adjourned.